Hello and welcome to Chapter 2. I hope everyone is doing well today. There are just a couple of things that I wanted to clarify in the chapter with you. And of course this is terms pertaining to the body as a whole. So we use these different types of terms to help orient a person who is listening to us describe an issue with a patient. Excuse me. So a couple of terms that I want to be sure that you understand clearly are here. This slide is straight out of your chapter, and the front one, anytime we refer to the front of the body anywhere on the front of the body, we refer to it as the anterior or ventral side. On the back side then is the posterior or dorsal side. So I always remember this by either I sit on my posterior. You might have heard that before. Or a shark has a big dorsal fin on its back, and that's how I remember my orientation of which is posterior and which is anterior. Quickly, a deep wound is a wound that penetrates the body, whereas a superficial wound is something that is on the surface. So that's pretty self-explanatory. What may not be so explanatory are these two terms, the proximal and distal position. So you've heard probably people talking about being in close proximity to someone else. That means they, again, are close to another person. So if we are orienting someone about a position on a person's body, then we are wanting to show them that a laceration or a cut is proximal to an area of the body, and in this case it would be the nearest joint of orientation. So in this case it would be the hip joint. So this laceration, if we imagined a cut on the backside of this man's leg, a person would say there is a proximal laceration on the posterior side of a person's thigh. If it is further down the leg away from this common joint area, then we would say it is a distal laceration on the posterior side of the patient's thigh. That means there's some distance away from that joint of orientation. So that would be anything that is below the joint. So here from the shoulder to elbow, this would be a proximal position. This would be a distal position. But if we're talking about orienting to the elbow, then this would be a proximal position and this would be a distal position. Next, let's talk about the planes of the body. This is a slide that's straight out of your book, and if you can imagine these different colored planes that are dissecting this person's body, just think of them as different colored pieces of glass. And so if we are talking about the frontal plane, just imagine a mannequin, not a real person, that's easier to think about, a mannequin having a clear blue plate of glass cut the body in half right down the middle so that you see the whole front side of a person and the whole back side of the person. That is the frontal plane. The sagittal plane would be perpendicular to that. Then a sagittal plane would cut the person into two halves right down the middle so that you have a right half and a left half. The transverse plane, you probably recognize this term because you know from your combining forms transverse or trans means across. So this is cutting the person across through the middle, and so that is how we can orient ourselves as far as the planes of the body. Now these two terms, medial and lateral, have to do with the proximity to the inside of the body or the outside of the body. So the medial plane, which is closest to the middle, M for middle, is directed through the middle of the body, and the lateral plane would be out by the side. As you know, latero means side. And then just quickly, this makes sense. If you're laying on your spine, you're in the supine position. And if you're laying on your stomach, you are on the prone position. So, just a little bit of help to help you orient yourself within the body. I am looking forward to any questions that you might have, and I hope you are having a great week. Thanks for listening.